So what are the surgical options if you've torn your ACL? Once you've been indicated for surgery, the treatment strategies fall under two broad categories. The ACL can either be repaired or it can be reconstructed. The vast majority of patients have what we call an ACL reconstruction, and that's where the damaged tissue is replaced with healthy tissue from your knee. So typically those tissues are tendons, and they can either be the patella tendon, the hamstring tendon, or the quadriceps tendon. And depending on your goal and your aspirations for sport, the appropriate graft is chosen. Those tendons are then made into what we call an ACL graft that's secured into the knee to complete an ACL reconstruction. Less commonly, we can also perform what we call an ACL repair, whereby the tissue isn't so badly damaged that it can actually be saved. Typically, that involves the ACL peeling off the bone, and then you pass stitches through it and reattach it back to the bone to restore stability to the knee. A common question I get asked is, what are the effects of taking my patella tendon or my hamstring or my quadriceps tendon from my knee, and will that affect my function? Typically what we're doing is we're not taking the whole tendon. So if you take the patella tendon, for example, we use approximately 20 to 25% of it. And that is then used to reconstruct your ACL. And taking that amount of tendon does not significantly compromise your ability to return to sport or indeed cause any long-term issues. One of the things that I tell all my patients who present with an ACL tear is that despite it being a devastating injury, with modern ACL techniques and our accelerated rehab protocols, the outcomes of this surgery are excellent, and the vast majority of athletes get back to doing what they love, performing at an extremely high level, and in some cases performing at a level that they've never performed at before.